In this video, we'll be going over iron deficiency anemia questions. There'll be 6 questions. I will read the question to you, then pause to let you think, then I'll provide the answers, and we'll discuss which answer is best. If you want more information on this topic, you can usually find it in your nursing resources under vascular, hematology, and we will be reviewing the medications for this anemia, the iron supplementation. Let's get started. Question number 1. A young woman comes to the clinic complaining of dizziness, dyspnea on exertion, palpitations, and fatigue that has been worsening over the past few weeks. What is important for the nurse to ask when considering iron deficiency anemia? Is it number 1, recent life stress, number 2, menses history, number 3, smoking history, number 4, normal activity level? And of the answers provided, number 2 is your answer. In the question, it's just asking us what are the risk factors for iron deficiency anemia, and we have to pay attention to that she's a young woman. And the thought should have been around, for her age, what are her menses like? Could she have a slow bleed going on, maybe from a GI ulcer? I want to know, does she eat meat? Is there poor intake of iron? Or maybe she's pregnant. So in the further learning, you should also know other risk factors for iron deficiency anemia, not just in young women, but it can be common in adolescents. They're growing, their blood volume is increasing, they might become iron deficient. Toddlers whose primary diet is milk, pregnancy, older adults who have decreased iron intake or decreased absorption from the small intestine, anybody with that slow bleed, ulcers, postmenopausal women sometimes get uterine fibroids. Those can bleed and cause anemia, colitis, diverticulitis, any GI issue that slow bleeds could cause it. Question number 2. A nurse is caring for an older adult with iron deficiency anemia. The nurse is assessing the client. Which signs and symptoms are specific to only iron deficiency anemia? Select all that apply. Is it number 1, cracking at the corners of the mouth, number 2, a beefy red tongue, number 3, inflamed pale tongue, and or number 4, fatigue? And the answers here are number 1 and 3. In the question, it said are specific only to iron deficiency anemia. Select all the signs and symptoms. So the thought, yes, iron does include all the general symptoms if you watched the video that talks about general anemia. However, this question is specifically asking only iron deficiency. So glossitis is that inflamed pale tongue in this case because it's a pallor. Cheilitis is the cracks in the mouth. And they can also have pica. Pica is where people eat dirt and weird objects, clay, because of mineral deficiencies. So in our answers, if we true false this because it's select all that apply, number 1 is true because that is how we assess the cheilitis. It's the cracking in the corners of the mouth. Number 2 is false. That would be your vitamin B anemias. Number 3 is true. That's that pale pallor glossitis. And number 4 is false because the question asks for specific to only iron deficiency. Fatigue happens in anybody who's anemic, not just iron. So in the further learning, something else that we saw here is make sure that you can go between medical terminology and lay terminology. For example, if you're studying cheilitis, you can't say to your patient, "Hi, do you have cheilitis this morning?" They won't know what you're talking about. So make sure sometimes with these medical words that you can go back and forth between the medical terminology and then knowing what that question is that you're asking so your patient understands you. So in that case, it's noted by asking them if they have cracks in their mouth and or looking yourself. So it's a good idea to always know the general signs and symptoms, but also the specific ones, because sometimes they will ask you for both. Number 3, the nurse is discussing iron deficiency anemia with another nurse. The nurse knows that, another select all that apply. Is it number 1, iron deficiency anemia is a hypochromic microcytic anemia. Number 2, iron deficiency anemia is diagnosed by low ferritin levels and low total iron binding capacity, which is a TIBC level. Number 3, Iron deficiency anemia is commonly seen in bleeding and pregnancy. Number 4, iron deficiency anemia can be seen in adolescents due to blood volume and muscle growth demands and possibly limiting intake of meat products. And the answers here are numbers 1, 3, and 4. This is a select all question, just what do we know about it? The thought could be anything around all your knowledge of iron deficiency anemia, including the risk factors, how it's diagnosed, the treatments, how it presents. So if we true false this one, number 1 is true, number 2 is false, number 3 and number 4 are true. If we go to the further learning, that will explain it a bit more. So in iron deficiency anemia, the diagnostic labs are, of course, the low H&H, which is true for any anemia. The iron levels will be low ferritin, but the TIBC will be high. TIBC stands for the capacity to bind iron, and if iron is not around, then the cells do have places or capacity available on the cell to bind the iron. So that is how we diagnose iron deficiency: low ferritin with high capacity to bind. Also, the word hypochromic in answer number 1, hypochromic refers to color. Chromic means color, hypo means pale or less color, and when iron leaves cells, it does make them pale, just like it makes skin color pale. So if you're looking at the cell under a microscope, like they do when they get a peripheral blood smear, those cells will look pale in color, giving iron the name hypochromic. And this other description of iron is the word microcytic, also seen in number 1. Microcytic refers to size. Cytic refers to size. And so if something's micro, it means it's small. And we can tell that when we're drawing blood and we do what's called the mean corpuscular volume, or MCV, and we will see that it's low, less than 80, and the mean corpuscular volume refers to size. And so if the cells are less than 80, that means the cells are small, which happens in iron. When iron leaves cells, the cells become small, and the term we use is microcytic. Question number 4. A pregnant client is diagnosed with iron deficiency anemia and being treated with iron supplements. The patient calls the clinic and states her stool is black. What should the triaging nurse do? Would you do number 1, tell the client that black stools are normal with iron supplementation? Number 2, ask the client if she is recently feeling dizzy, lightheaded, or short of breath? Number 3, tell her to come in to check her blood pressure. Number 4, tell her to stop taking the iron supplements. And the answer here is number 2. In the question, she made the phone call, so it's important to see that the patient calls. She is saying her stool is black, and then it's asking you what you should do. And do means what's your action, what's your clinical judgment. Use the nursing process. And be very careful. Just because we're learning about iron and we're being taught that black stools are just common with iron treatments, that's true, but you still want to at least assess first and ask the question, because we also know black stool is a sign of GI bleeding. Could you imagine telling that mom on the phone, oh, it's just a side effect of iron, and then later on you find out she had a GI bleed, or maybe some vaginal blood was getting caught up and she thought it was from the stool? We'd be in a lot of trouble. So it's important just to ask the question. Number 2 just quickly triages her, maybe gives a reason that it could be something else, or maybe it is just her iron. If she was in person, I would definitely do a quick blood pressure check just to make sure it wasn't, and then I would tell her, oh, it's probably just her iron. So in the further learning, we're just going to take advantage of this slide on oral iron to also make sure that you review and know your oral iron side effects, which I like to call the dangers, and your nursing considerations, which I like to call the duties, because that's where a lot of questions come from with your medications, is dangers and duties. So besides assuming that black stools are just from iron and not even asking the question, some other side effects could be stomach pain, bloating, nausea, vomiting, constipation. And so my nursing duties with PO iron are that they should take on an empty stomach to increase absorption unless it's not tolerated. Take this with vitamin C to increase absorption, so a glass of orange juice is great to take it with. A lot of the medications come with vitamin C in it already. Avoid taking with dairy, that blocks absorption. If it is a liquid, make sure to use a straw because it will stain the teeth. And there are slow iron forms available if the client is complaining of constipation that you might want to recommend. Question number 5. A patient with chronic iron deficiency anemia is ordered for iron dextran intramuscular. The nurse knows to use the Z-Track method when injecting this medication. Drag and drop the Z-Track method in order. So how would you put these in order? Number 1, clean the site with alcohol and allow to dry. Number 2, perform hand hygiene. Number 3, don clean gloves. Number 4, explain the procedure. Number 5, with the dominant hand, pull skin to the side about an inch. Number 6, inject at a 90-degree angle. Number 7, once the medication is injected, remove the needle and release the skin. Number 8, perform the rites to medication administration. Gave you more than a few seconds to try to put that one in order because it is quite the list. And so the thought really should just have been around, this is a medication, so that thought should have been there. How to do the Z-Track exactly, that thought should have been there. And how to give IM injections. All of that should have been in your mind as you're looking at this. And so in order, the order goes 8 first. Make sure to, because that would have started actually at the MAR. You would have been outside the room beginning to check the rites of medication administration with the MAR and the medication. That continues as you go into the room to then be doing number 4 as you're finishing up the rites and you're checking their armband. You start doing number 4, which is explaining what you're going to do. And then number 2, wash your hands. And then number 1, clean the site with alcohol. And as you're allowing the site to dry, go ahead and put on your clean gloves to give your shot. Remember, we always wear gloves to give shots. And then, so that would have been number 3. And then number 5 is just the Z-Track method. So 5, 6, and 7 are in order, and that's how we perform the Z-Track method. Pull it aside, inject slowly, and then once the medication is in, we remove the needle and release the skin. And just double check that nothing is leaking, and we're done. So 8, 4, 2, 1, 3, 5, 6, 7 was the order. So something else in the further learning, I just think it's a good idea to know when we have to use the Z-Track method. And that Z-Track method is used to stop medication from leaking out, especially for medications like iron that can stain the skin and the sub-Q tissue, and also for medications that are irritating to tissue like haloperidol and Vistaril. Last question, number 6. A client with severe iron deficiency anemia is ordered IV iron dextran. The nurse gives a test dose before giving the medication. What is the rationale behind the test dose? Is your answer number 1, the test dose is done to ensure the veins are tolerating the injection. Number 2, the test dose is done to make sure the client is not experiencing a metallic taste with administration. Number 3, the test dose is done to ensure there is no dangerous reaction. Number 4, the nurse did not need to do a test dose. And the answer here is number 3. This is IV iron dextran, and it's asking what is the rationale behind giving a test dose. And you had to remember that IV iron dextran has a risk for a severe allergic reaction called anaphylaxis. And so test doses are done to ensure there is no allergic reaction before giving the full dose. And in the further learning, again, we're just going to take advantage of this question to go over IV iron dextran, the dangers and the duties. And the dangers of this drug is the anaphylactic reaction, which is a very fast or irregular breathing and or pulse, gasping for breath, face changing color, hive-like swelling, puffy eyelids, or puffiness around the eyes, chills, backaches, dizziness, headache, fever, joint or muscle pain, nausea, and vomiting. Very dangerous. If that happens, well, first of all, our duties is to give that test dose to ensure there's no anaphylactic reaction. We would give the full dose an hour after the test dose is done, and there has been no issues. If during the medication they do experience side effects, we need to stop the medication right away, call the provider, and we'll be treating as anaphylaxis. And then, of course, document the reaction so they don't try to give it to them again. That's it for iron deficiency anemia. We got through the risk factors, we got through some diagnostic tests, we got through the signs and symptoms specific to iron deficiency anemia, and we talked about the 3 forms of supplementation: PO, IM, and IV. Hope you enjoyed critically thinking and learning through these questions. If you like this video, we have more like these. Subscribe to our channel. Also, please don't forget to like this video, and you can always find us at sciencestrategies.com.